Good morning. Today we are discussing about the topic oral malodor. Under the following headings, history, definition, classification, etiology, and etiology intraoral causes and extraoral causes, pathogenesis, role of volatile sulfur compounds in the pathogenesis of halitosis, correlation between the presence of pathogenic microflora in my subgingival microflora and halitosis, diagnosis of malodor, preventive measures, treatment needs, management, conclusion, and preferences. Coming to the history, halitosis is a medical term first coined by Listerine Company in 1921. Scientific research on halitosis began 1960s when Tornazich and Richer in 1964 reported the volatile sulfur compound or the VSCs are the primarily responsible for the volatile sulfur compounds are the primary etiological factors for the malodor. Townsend in 1978 found that the offensiveness of oral malodor increased with the increase in periodontal destruction. There is a correlation. Coming to the definition, halitosis can be defined as subjective perception after smelling someone's breath. It can be pleasant or unpleasant, or even disturbing, if not repulsive. If it is unpleasant, it's termed as oral malodor. Halitosis originates from the Latin word halitus, meaning breath, and Greek nosis means abnormal or diseased. What are the other synonyms used for halitosis or oral malodor? Breath malodor, oral malodor, fetor exore, fetor oris, bad breath, foul breath, halitosis. The prevalence of halitosis? In the studies done in United States, the prevalence of halitosis was found 10 to 30%. After decay and swelling, the patient will be usually coming to or reported to the clinic is the third is halitosis. Coming to the classification, according to the duration, temporary or exogenous, the temporary malodor are caused by certain foods, example the garlics or the drinks of for transient period after consumption. These external substances, when ingested, get absorbed into circulatory system and release of odors through breathing and through saliva. The best way to control this type of malodor is to refrain from ingesting and avoiding offending substances. For endogenous or persistent, persistent or endogenous malodor is primarily due to proteolytic anaerobic gram-negative bacteria which cause protein digestion and produce several fetid substances that is volatile sulfur compound, primarily for hydrogen sulfide and methyl mercaptan. This is endogenous. Other classification based on the origin, genine halitosis, pseudohalitosis, and halitophobia. Genine halitosis which may be either physiological halitosis or pathological. Again, the pathological halitosis is classified into extraoral causes and intraoral causes. In general, it's classified into genine halitosis, pseudohalitosis, and halitophobia. The true halitosis, genine halitosis, again, it's classified maybe due to physiological reason or pathological reason. Again, in the pathological reason, it's classified into extraoral or intraoral causes. Coming to the true halitosis or genine halitosis, which originates from the oral cavity and have a physiological or pathological etiology. Physiological halitosis may be transient, occur in the absence of any oral or systemic diseases caused by drinking or eating. Condition is short-lived and is temporarily and easily reversible. Pathological. This is permanent and does not resolve by usual oral hygiene methods and prevents the patient from carrying out normal life. Pathological halitosis should be treated as its therapeutic approach will depend on source of malodor. Another classification, depending on the origin, this pathological halitosis can be classified either to intraoral causes or the extraoral causes. Intraoral causes, the origin of the pathological condition is mainly due to oral cavity. or the posterior dorsum of the tongue. These are the main side which can produce the volatile sulfur compounds. The extraoral cause may be the upper respiratory tract or the lower respiratory tract, digestive system, and other systemic disorders. The intraoral causes due to the dentition, the deep carious lesion with food impaction and putrefaction, extraction wounds filled with the blood clot, purulent discharge, internal food impaction, acrylic dentures, or kept in the mouth at night are not regularly maintained or the cleaned. This is the intraoral dentition related causes. Intraoral periodontal infections. The gram-negative bacteria associated with the gingivitis and periodontitis. That is the main etiological organism involved in the periodontal disease. The Paraphragmonas gingivalis, Actinobacillicum actinomycetum comitans, Prevotella intermedium, Isobacterium nucleatum, and other known to produce volatile sulfur compound. These are the main etiological factor which can contribute for the oral malodor. The amount of volatile sulfur compound in breath increases with the number and the depth and the bleeding tendency of the periodontal. If there is a increased in the bleeding tendency as well as the depth of the pocket is increased, there is a more amount of volatile sulfur compounds are formed. The low oxygen tension in the deep periodontal pocket also result in low pH and an activation of decarboxylation amino acid, the lysine or methane, to cadaverine and putrescine. These are the two malodor diamides. Thus, presence of gingivitis and periodontitis. It's the degradation of the protein. It produces into decarboxylation and produces amino acid. Later, it is converted into volatile sulfur compounds, mainly the hydrogen sulfide and dimethyl mercaptans. Volatile sulfur compounds aggravate the periodontitis process. There is a bilateral relation. There is an increased production of volatile sulfur compound. It may increase the further the pocket formation or increase in the permeability of pocket and the mucosal epithelium, and therefore the exposure of the underlying connective tissue of the periodontal tissue to the bacterial metabolites. There is a direct correlation between the volatile sulfur compound and the periodontal destruction. If there is an increased production of volatile sulfur compound, there is an increase in the pocket formation. If there is an increased pocket formation, there is a further increase in the production of volatile sulfur compounds also. Volatile sulfur compounds induce the deleterious changes in non-keratinized epithelial basement membrane and underlying lamina propria and speed up the degradation of the collagen and delay the healing of existing wound and affect periodontal cell functions. They also decrease the protein or collagen synthesis and inhibit the cell migration in the periodontal ligament cell and also interfere with the enzymatic and technological reaction leading to the destruction while showing an increase in the release of interleukin and the prostaglandins. It has been established that there is a transition of health to gingivitis when the lining epithelium, whose permeability have been increased or enhanced by volatile sulfur compounds, is invaded by the bacterial antigens such as lipopolysaccharide. The initial gingivitis progresses to periodontitis as both of soft and the hard tissue are affected. More tissue destruction leads to increase in the concentration of the sulfur compound and there is a worsening of the periodontal diseases. The increase in the permeability of the oral mucosa and also it causes the breakdown and leading to further bacterial invasion and more production of the volatile sulfur compounds. Although no inflammatory response could be initiated by the topical application of the lipopolysaccharide to healthy gingival or the exposure of the gingival tissue to hydrogen sulfide facilitated penetration of the lipopolysaccharide and resulted in inflammation. This is the second intraoral endogenous causes. The third is the dry mouth. Patient with xerostomia presents large amount of plaque on the teeth. processes, and the dose of the tongue. Increased microbial load and the escape of volatile known as gases when the saliva is dry leads to halitosis. Tongue and tongue coating. Many studies implicate that the tongue is the primary source of oral malodor. The large surface area of the tongue can harbor high number of bacteria. The surface is modified by the many number of coatings. That is the salivary accumulation on the dorsum of the tongue, which increase the formation or the entrapment of the foot onto the dorsum of the tongue, which may lead to further production of the volatile sulfur compounds. That picture shows that the coating on the different heavily coated tongue, which may harbor, the coating will harbor the food, more number of the food remnants as well as the bacteria, which may lead to further production of the degradation of the protein as well as the production of the volatile sulfur compounds. Coming to the extraoral causes, the ENT causes, the ear, nose, and the throat. ENT causes include acute pharyngitis, maybe viral or the bacterial pharyngitis, virulent sinusitis, virulent tonsillitis, postnasal drip. The postnasal drip is associated with chronic sinusitis or regurgitation esophagitis. Mainly the acidic content of the stomach reaches the nasopharynx and causes the mucositis. This is perceived by patient as a liquid flow in the throat, originating in the nasal cavity, causing a very strong breath malodor. Coming to the lower respiratory tract, the pulmonary include the chronic bronchitis, bronchiectasis, bronchial carcinoma. All may leads to the into the oral cavity and giving the malodor. The gastrointestinal tract, the pathology that might be responsible is less than 1%. That is the Sencke's diverticulum hernia in esophageal wall, allowing the accumulation of the food debris and thus putrefaction in that lower gastrointestinal tract, which may lead to halitosis. The liver, the cirrhosis of liver, the ammonia will accumulate in the blood and will be exhaled. This is also called hepaticus. That is the cirrhosis of liver may leads to fetal hepaticus. The malodor produced by the liver cirrhosis is the ammonia smell or the that is called fetal hepaticus. Kidney related, the chronic glomerulonephritis leads to increase in the uric acid in the blood, which is expressed in the expired air with the typical ammonia-like breath. Other systemic, mainly the diabetes, the type 1 and the type 2 diabetes, particularly in the type 1, accumulation of the ketone, the fruity odor, trimethyl amenorrhea. So defect that prevents the transformation of trimethylamine to the trimethyl monoxide, resulting in the abnormal amount of the molecule. This leads to a typically fishy odor of the breath, urine, sweat, and expired. Other causes that the hormonal causes, the progesterone level during menstrual cycle also causes a typical breath malodor. Medications such as metronidazole can cause breath malodor, that a metallic it is, eucalyptus, or arsenic, everything. We made some medication. Even the zinc oxide we are keeping for the temporary or even the denture breath, like that we also may cause the that is the exogenous. Here it is the endogenous cause is the metronidazole. Coming to the pseudohalitosis, we discussed about the genuine halitosis under two headings, that is the physiological halitosis and the pathological. Now coming to the pseudohalitosis or the psychological halitosis. This condition is falsely perceived. There is no true halitosis. The patient is feeling that there is a halitosis. This is also called halitophobia. Patient have the fear of that there is a this bad breath is there. Patient feel that slight bad breath when seek the treatment. But despite adequate does not require the adequate treatment, but there is a still complaint that there is a feeling, there is a phobia. That's called halitophobia. Coming to the pathogenesis, how it is. Finally, the production of hydrogen sulfide or the methyl mercaptan, that's a volatile substance which contribute for oral malodor. The bacterial or the epithelial cell death from the intraoral food degrades into the proteins, degrades into polypeptide chains, then into individual amino acid. Later, these amino acids are converted into the volatile sulfur compounds, including the hydrogen sulfide and the methyl mercaptan. This volatile sulfur compound increases the antigen permeation through the epithelium, thus cause initially the gingivitis. Then again, there is a correlation between the increase in the production or the increase in the incidence of periodontitis. The inflammatory reaction results in connective tissue breakdown, and some may to lead into the further degradation of the epithelium as the connective tissue, which leads to deeper pocket formation and increased destruction. So thus, the volatiles of a compound contribute for the more of periodontal disease destruction. What are the factors involved in the etiology of the halitosis? Mainly the volatiles of a compound, the hydrogen sulfide, methyl mercaptan, dimethyl mercaptan, putrescine, cadaverine, all these volatiles of a compound contribute for the malodor. The discriminate epithelial cells and food remnants trapped in the retention side, especially the periodontal gingival sulcus as well as the dorsum of the tongue, giving rise to the oral malodor. Etiological classification, another classification given by Dominic Liu in 1982. It's easy to understand. Halitosis is due to local factors of pathological origin. Halitosis is due to local factors of non-pathological origin. Halitosis is due to systemic factors of pathological origin. Halitosis is due to systemic factors of pathological origin. Halitosis is due to systemic administration of drugs. Halitosis is due to xerostomy. Coming to the first, halitosis is due to the local factors of pathological origin. Local factors of pathological origin. Extensive caries, gingivitis, periodontitis, Vincent's disease, necrotic tissue from ulceration, dentigerous cyst, pharyngitis, tonsillitis. These are the etiological factor which contribute as a local factors of pathological origin. Non-pathological origin includes the morning breath, excessive smoking, tension breath, after placing the restorative material, eugenol or the formocresol. Coming to the systemic factors of pathological origin, the diabetes, acute acetone fruity odor, kidney, odor of ammonia, hepatic failure, fetal hepaticus, resembling the fresh cadaver, lung abscess or tuberculosis or bronchitis, foul and putrefactive, blood dyscrasias resembling the decomposed blood. Halitosis due to systemic factors of non-pathological origin. The metabolites ingested food. A veg has less tendency than the meat containing fat because the more of the proteins which is containing that will be converted into the lastly converted into molecules of food. Excessive alcohol alteration of the microbial flora also cause the proliferation of the odor fermenting organism. Anger odor due to putrefaction of the pancreatic juice. Allergen is due to systemic administration of drugs, anti-neoplastic drugs that are methotrexate, actinomycetin, mycetin D, fluorouracil, or xerostomia, which even the candidiasis, the gingival bleeding, and the oral ulceration. Antihistaminics, which reduce all the production of the organs. Tranquilizers, atropine-like drugs, diminish the salivary production. Even antihistamine reduce the salivary production and therefore decrease in the cell cleansing activity. And this is due to xerostomia. What is xerostomia? Xerostomia, there is a decreased production of the saliva. The mouth breathing, heavy smoking, aging, Sjogren's syndrome, salivary gland aplasia, radiation therapy, emotional disturbances, eye fever, dehydration. These all may lead to xerostomia, and further, xerostomia may lead to the production of poultry sulfur compound, and thus finally leading to the halitosis. The rest of the things will be discussed in the next class.